So feel free to put any questions in the chat as well. We're quite more than happy to answer any questions. So I'm going to introduce Lydia. So Lydia is not only a friend, but also, you know, her background is, well, what she doesn't know isn't worth knowing. Let's put it that way when it comes to skincare. So she's highly experienced skincare specialist with a few years, at least 30 years in the industry.
Fine.
We just say a few between us when we talk about me and Ros. She's trained in both Europe and the US under a renowned board certified dermatologist and a range of expert specialists in cosmetic surgery and laser treatments. As the founder of Glow Skin Beauty UK and Ireland, Lydia combines deep clinical expertise with a genuine passion for exceptional customer service, and that includes people that she works with as well, and outstanding treatment outcomes. She is widely respected as a trainer, mentor, definitely, we're always on the phone, an all-round expert in aesthetics dedicated to elevating standards and empowering professionals across the field. So I'm going to throw it over to you, darling.
Wow, thank you very much. And thank you for having me. It's a real pleasure. I hope that tonight we'll be able to cover off some questions and topics that people have got, you know, little concerns over. And obviously, if there's anything else that comes up after this, then you guys know I'm always here for you to help out with any questions or queries. So I've just seen there's a question in the chat. Shall I open the floor with that, answering that question?
You're the boss now.
Okay. Oof, dangerous. Okay, so the question that we have in the chat is that I have a concern regarding old pigmentation on my face from eczema. So obviously it's quite tricky to talk about a specific person's skin because I don't have any history or pictures and things like that. So let's talk about skin and pigmentation and eczema as conditions and concerns anyway. So pigmentation, one of my favourite things to talk about, just because I have a lot of experience with treating different types of pigmentation. So pigment can happen for lots of different reasons. Sometimes it can come from medication, hormones. So, you know, there's a pigmentation for pregnancy. There's a pigmentation that can come from, like this example, from an eczema. So it's kind of a scarring kind of pigment. There can also be deep pigments. There can be superficial pigments. So we have a little way of testing what depth of the skin the pigment is in as practitioners. And then what we can do is once we kind of have an idea of the depth of that, we can then look at treatment options to help to get rid of that. So treatment options for pigmentation can be quite broad. Some pigmentation you can lift out really quite easily with just good quality skincare. Other pigmentations might need a little bit more work. So with those kind of pigmentations, you might think about doing some chemical peels. You might think about using some form of a laser. There are different lasers for different pigments, some IPLs, some true lasers. Microneedling might be another option as well. So this is where it really is important that you find a good practitioner, like these wonderful women that are on here today, who can really assess your skin and really give you a true and good treatment plan, because this is not going to be a one and done either. The main thing to remember with pigmentation, and certainly in certain types of pigmentation, is that once the cell in the skin, which is called a melanocyte, has been what we call switched on, which kind of means it's been triggered, it will keep sending up this pigment, and it kind of sits there and it's heightened. It's almost like it's waiting for something else to trigger it again to send up more pigment. So we have to make sure that we manage that cell and we look after it by, in terms of skincare, the biggest thing you can do is obviously using your SPF. And for, which leads me into kind of eczema as well, for skin types that what we call compromised. So it could be pigmentation, it could be aging, it could be eczema. Those skin types, rosacea is a huge one. Those skin types, because the skin is already quite weak, it's really, really important that you use an SPF that is sadly a physical SPF, and therefore that kind of whitish tint to it. It's not as nice as the chemical SPFs. The chemical SPFs are the ones that tend to rub into the skin really, really quickly and really easily and do smell like holiday. The problem with those is that they, in a compromised skin, they allow the UV to penetrate into the skin, and then a chemical reaction happens with the ingredients, which then neutralizes that UV in the skin. Now, if your skin is already compromised and is struggling, to ask it to then have a positive outcome to that chemical reaction is just that little bit too much. Whereas a physical SPF, because most of them will contain a metal like a zinc, for example, that tends to be what gives it that kind of chalky white look as well. What that will do is the UV will come, but instead of penetrating the skin, it will just reflect straight off the skin. So it's a little bit like having an umbrella over the skin where you're completely protecting any absorption of the UV. And in a weakened skin, that is the best way to look after it. So SPF, you will hear us all bang on all the time about the importance of SPF on your skin. If there is just one product you're going to put onto your skin to help to prevent aging, prevent pigment, prevent lines and wrinkles, it's going to be that SPF. Okay. I keep seeing things on the chat, so I'm just keeping an eye on it. So if my eyes flicker, just excuse me. Eczema. So eczema can be again, a bit of a tricky one because it can flare for various different reasons. A lot of dermatologists will prescribe sort of topical steroids quite commonly, and then they can obviously have an effect on the body because it's systemic. If you're taking medication as well, and then obviously you can get side effects from that, depending on the skin color as well. Lighter skins, if you do like a bit of scratching or anything like that, even on arms, legs, sometimes I know with eczema patients, they get very hot and very itchy at night, so they're kind of scratching when they don't realize it, and that can then it can exasperate it and cause more inflammation. So then in like a lighter skin, for example, you can cause an awful lot of redness, and that redness can hang around for a long time. And then in a darker skin, you can get more pigmentation come up, and that's what we call PIH. So the good thing about PIH is that it's quite superficial in the skin, and so it is quite easy to treat that one. The difficulty is that it takes a little while to disappear. So for some patients, it can be quite frustrating because it's there, and it takes a little bit longer for it to go. But yeah, that's kind of the way we would look at treating those concerns. And again, with eczema, it's tricky to say on a video tonight because it's so individual for the patient, but it would be a case of doing a thorough consultation, going through all the medical history, trying to work out what those triggers are and avoiding them. Diet is obviously a big one as well. Your nutrition, you can look at supplementing as well. So it's quite big and it's quite broad. But again, this is why the clinics that I work with are so good for skin, because they will look at this whole holistic approach rather than just throwing like a topical steroid at the situation, which doesn't actually do anything to long-term treat it just shuts the skin down, and therefore you get that kind of reprieve from the itching and the flaking, but it doesn't actually resolve it. So I've got another question here. Can you recommend any SPFs? I use Nivea. So of course, I am a glow girl. You can see that it is glow. So of course, I'm going to recommend Glow Skin. So in Glow, we have we have 3 SPFs. So we have an SPF 40, which is a mineral. I'm sure the girls will pop a link on for your shop, I'm guessing, guys. Yeah. So we can pop a link on here and let you have a look at that. So there's the SPF 40, which is colourless, and then we have 2 SPFs which are tinted. One is an oil-free and one is a more hydrating, so depending on your skin type. And obviously with the tint, that's quite nice because it gives you a little bit of coverage and also a little bit of colour as well. So that would be my recommendations. But obviously with SPFs, if you wanted to buy SPFs from over the counter and places like that, then it's a case of ask the question if it's a physical or if it's a chemical. And I'm not saying that chemical SPFs are bad, but it's just that if you have a certain skin condition, we would always recommend the mineral version over the chemical version, because it's better for your skin. I hope that helped. And then, oh, brilliant. Yeah, rather than just pop the link on there. So that's answered that question. Just to talk about skin a little bit more broadly, really. A lot of people will ask questions like, what is the... You're very welcome, Sadia. One of the questions is, what is the best thing to use on my skin? I just want to use one product. And again, this is a really tricky question to answer, because people will have different opinions. My answer to this is always the same. There isn't one product that is going to give you the skin of your dreams. Sadly, it doesn't exist. So what we have to do is think about, what can we do to protect our skin? So it's almost like, if you just want to use one or two products and draw a line in the sand and be like, this is where my skin is, I don't want it to change, then it would be a cleanser, and then it would be an SPF, because the cleanser is obviously going to remove dirt, oil, makeup, all that kind of thing. And then your SPF is going to prevent damage from UV, from antioxidants. Not prevent from antioxidants, prevent from free radicals, because it has antioxidants in it. And also, the biggest thing that I think people don't, or maybe aren't quite as aware of. So we're all sat here tonight in front of our devices. I've got two screens in front of me. I've got my ring light, of course, and they're all emitting blue light. And blue light has been proven to be more damaging than the sun's rays. So now a lot of medical grade SPFs have a filter in to help to stop the absorption of the blue light as well. So that's another reason why it's always good to look at a medical grade skincare line rather than an over the counter, because they do tend to do more research and development into skin and have a better understanding of these. And then what happens is what I call the cosmetic market, that kind of catches up a little bit further down the line. So yeah, when people say as well with SPF, the other thing, I feel like I'm beating the SPF drum quite a bit and quite hard tonight, but the other thing is that you must always use it, even if it looks like a dull day. UV can penetrate through glass. So if you're in an office environment, or if you're in your car, or if you're obviously out and about directly in it, you're always absorbing those rays. So we need to make sure that we're wearing that SPF and reapplying if we're out and about directly in the sun, at least every 2 to 4 hours. Okay. Then treatments. People always ask me about treatments as well. So again, there's many treatments that you can have in this industry now. It has grown massively over the years that I have, just a few years that I've been involved in the industry. But again, I always think a really good starting place is your consultation. The more thorough the consultation, the better the outcomes is going to be for you. I know the guys at Rosem have got an awesome skin analyzing device. I mean, I say it's awesome. It's not always awesome, because you can get in it and it tells you, you can be 30, but you've got skin of a 40-year-old, which is not great news. The good news is that the team can help to reverse that and get you back to a skin age of 30, which is always a bonus. But the point is that it's real, it's a reality, and it does help you to understand what is going on with your skin. And as practitioners as well, it helps us to understand what's going on so that we can make sure we get exactly the right treatment for you. And then a good place to start is with kind of maybe some facials, some chemical peels, because you tend to find with those treatments, they're really good for lifting off dead skin cells that have been hanging around for a while and start to give you that kind of glow and that dewiness back to the skin. It's also really important to prep the skin ready for any other treatments that you might do that might be a little bit more aggressive, or that maybe have a little bit more downtime. because with those treatments, you tend to want to kind of work on the deeper layers of the skin. So to jump in and have those treatments from the get-go is never the best way. It's always better to do some preparation of the skin and get the skin into a healthier state, so that when you ask it to repair well or heal well after the treatment, that's what you get. And sometimes people are a bit impatient and want to get going with things quite quickly and try and skip that step. But it is really, really important that you don't skip a step. It is a journey. You need to be on that journey fully, and you always need to trust your practitioner, because they do have your skin as it's almost, as a practitioner, you kind of always feel that skin is your skin, and you want to treat it and get the best outcome possible. And sometimes it's quick and sometimes it's not so quick, but always trust the process and the journey that you will be on. So treatment plans are always a really good way to go in clinics as well. And again, I know that the girls here have great treatment plans in place. And again, it's really important to follow those and to make sure that you do your part in that as well. So, if you're coming in for treatments, you must make sure that you follow the home care, the aftercare, and then continue with that as well. Because, if you come in for treatments, once you finish your treatment plan and you move into the maintenance phase, you might only be coming into clinic maybe every 3 or 6 months for your maintenance treatments. So in between them, it's really important that you are maintaining that work and using your skincare, because at the end of the day, you've probably paid a lot of money for treatments aren't necessarily cheap. It is an investment, and if you don't kind of keep that work up at home, it will affect the outcome of the treatment. So that's really important as well, and I think it's something we talk about an awful lot of practitioners, is that we're in this as a team and we just need you to do your bit at home as well. Let me just check the chat. Any other questions come in while I've just been talking away? No, I don't think so. I don't know if that's a good thing or a bad thing, whether I've been answering questions as we've gone along or gone off at a tangent a little bit.
No, it really helps. I know we've only got a short time, but it certainly helps. I'm quite happy to open if anybody wants to say anything or ask anything, this is your moment. You've got a specialist sitting there who knows her onions. So you've met at least one of these ladies, Lydia, when we had our event. You met Caroline.
Oh, okay. Oh, hi, Caroline. Hello. Nice to see you.
Hi, I was trying to work out how to come off camera there. Or
how are you getting on?
Yeah, all right. Yeah, skin's got a lot better. So obviously the rash has all gone down. So yeah, really good. So just
Amazing.
I'm feeling a bit paranoid now about not using enough SPF. So yeah.
I do beat that drum. I know. I'm sorry.
I know. I'm like sitting there thinking, oh my God, I'm just going to sit here like this.
And it's, you know what, the other thing as well is it's the amount that you use is another good point. So some people will say, I haven't got a cream here to do my little demonstration that I usually do. But, sometimes people just kind of use the end of the finger. You really need to use like from here to here in like a squirt. So it's a good amount of SPF as well. And the other thing is, and my mum, like, I love my mum to pieces. She has been my biggest supporter through my career. Anything that I've ever learned, she's always been my guinea pig, my model. She gives me honest feedback. So she's heard me bang on about things over and over and over. And unfortunately, I mean, it's going to be fine, but my mum has a little basal cell carcinoma that's just come up on the side of her nose. So she's just got to have a bit of treatment for that, which is fine. But we were just talking today, and she's going on a cruise again in about 3 weeks' time. And she said, oh, yeah, I must remember I need a cap. And I was like, pardon? I need a cap for the holiday. When have we ever worn caps in the sun, mother? No. A hat, a brimmed hat. The bigger the brim, the better. Tightly woven, no gaps through it. When you hold it up and you see lots of sunlight, that's going to let the sun in. So yeah, I blame my mother for the fact that I beat that SPF drum so much. But that is the other thing, you know, caps are great, obviously for shielding, but the sun can get around everywhere and it doesn't protect the lower face. So yeah, when we're out and about in the heat, in the summer, hats on, big brims, please, and lots of SPF, not just a little bit.
Hello.
Hello, you okay?
Yes, you.
Yeah, I'm good. You?
I'll tell you a bit about myself. So, by trade, I'm a pharmacist in a clinical GP setting and stuff. I've had pigmentation ever since really young. It's all mainly around my mouth here. Never been able to get rid of it. I've tried a Bagi product. Laser facial hair removal I did do as well. That didn't work really well for me, but it helped lift some of the pigmentation, but it's still really prominent and really quite, I feel like everybody sees it. And I feel like I'm getting some pigmentation around here now. So I think, I'll probably come and see you guys in the clinic for some advice and stuff.
Oh. Are you local, Sardia, West Bridgeford?
Yeah, I'm colic area.
That's not far then.
No, not too far at all.
Get through the holes that are all over the.
Yeah.
Oh, well, in the chat we've got some I wouldn't say special offers, but we've got some gifts. And my consultations are an hour and a half. We go through absolutely everything because a lot of the clients that come to me, they come off things like social media. I mean, these blooming things listen to you. You know, I mentioned
they do.
a steam mop 6 months ago. I'm still getting adverts on Facebook now. But a lot of these things are about channeling you. So Ros and I are both nurses. We've been nurses for quite a while, particularly in women's health, particularly in medical aesthetics. And a lot of people, it's easy to sell things. We're not a sales company. We're about, let's go right back to the basics. We could sell you everything in the room 10 times over, but let's talk about you, because like Lydia says, and I use that language a lot, and Ros uses it, is we're on a journey to get you where you need to be.
Where you want to be.
And like I was saying to one of my clients the other day, there's no point in you having a treatment. A treatment's a thing. It's a transfer of energy. But you wouldn't plant a seed and just walk away. You would make sure that it was in compost, it was watered, it had the right sunlight, it was in the right conditions for itself. And skin's the same. It's, you know, you're a pharmacist, you know, it's the biggest organ we've got, and it is a reflection of what's going on inside and outside. And we use Glow a lot for all of our clinical procedures, and I've worked with Glow 2012, started with them, and there's a lot of ranges out there. You go to Boots, there's stuff.
There's so much stuff out there.
What do you want, the Porsche or the battered old Fiat Panda? And the thing with Ros and myself is that we stand by what we say because we use it all ourselves.
Yeah. Oh, absolutely. And I think that's the other thing. You know, influencers, social media, there is so much on there, and you know, not all of it is bad. Some of it is kind of the correct information, but it doesn't necessarily mean it's correct for you as a person or your skin condition or your histology. It just it baffles me as well, like how, because I go to a lot of different clinics up and down the country, and obviously I've worked abroad as well, and the amount of consultations I've sat in, I genuinely have lost track of the number of them. But the times that people come in and they sit and you've got a real expert across the table, and people are still a bit like, and I just think, I don't get it. Like, I wouldn't go to my dentist and like have a checkup done, and the dentist say, "Yeah, you need a filling, Lydia," and you wouldn't sit there and be like, "Do I really though? Do I?" Because you know, I've read that you don't. You can just brush your teeth and floss them, and you've got great teeth. Like it's bizarre when it comes to our skin that we're not quite as we're just not quite as picky about where we get our information from, and what we choose to listen to, and what is marketing, because you know, like Emma said earlier, that there's so much out there on the market that you could sell. I mean, I'm going to that god awful place called P. Louise with my 9-year-old daughter in a few weeks, and because I'm a bit of an ingredient geek when it comes to skin. I didn't even know what P. Louise was, but you know, it's that peer pressure. I don't want her to not go with all her friends. So I just went online, had a look. I mean, the stuff that is in that it's disgusting, absolutely disgusting. I can't believe they put it on anybody's face, let alone market it to kids. But you know, people go mad for it. Girls at her school have got like 9, 10 lip balms in their bag from this brand because it is that marketing. Now, secretly, I'm like, amazing, because you're all going to put this rubbish on your skin, and it means that you're going to then want to correct all that bad stuff that goes on with your skin, and then look at probably buying a decent brand like, you know, like Glow, or coming to visit some of our clinics like Rosem. But equally, it is, you know, it's so important to get on that journey and get on board and trust your practitioner, and really get into the process, because you know you've obviously already used some really good quality products. Sabagi is a great brand for pigmentation. I worked for them a long time. Dr. Abagi is the dermatologist that trained me. So you know, the fact that it didn't work for you, we'd probably want to look into that a little bit more as to what was the protocol that you were on, because again, sometimes practitioners don't quite get the protocol right. So you know, if you come and visit the team, Emma can go through all of that in your consultation, and you can discuss that and find out why it didn't work. If it is because you weren't on it long enough, you were on it too long, or it's not the right treatment. Maybe it's not pigmentation, maybe you think it's pigmentation, but actually when we look at you on the scanner, it's something different. You know, there's so many different things, so it's hard to pinpoint it on here for you tonight, but hopefully you feel, you know, feel nice and confident in how the team work.
Yeah.
The other thing is as well, I know with this team, if they don't know something, they won't flag it. You know, they'll say, I don't know, I will find out for you. Or, you know, there is that they know their limitations as well, which is another great thing with practitioners, when they know to refer.
Yeah.
So yeah.
It's recently, didn't we, where somebody, and you've probably come across this as well, Sadia, I had to do an MHRA yellow card because somebody had been injecting themselves with something they bought online, and she'd had a really adverse reaction. So it's basically a peptide that when you go to the website, it says for research use only.
Oh my goodness.
Yeah. So I knew what I was saying. So obviously Lydia works with the obviously Glow practitioners all over the country. And we've got our own little group. But I just said to Lydia, I know what I'm saying is right. And I know what I'm thinking is right. And I know what I need to do. I just need to bounce it off someone. And it's quite nice that we're not in our little tiny clinic. We've got all this experience. I mean, you've got aesthetic practitioners that have been doing it sort of like 20, 30 years. You've got nurses, we've got doctors, and we can bounce ideas off each other. You know, obviously Ros and I, quite a lot between us, but it was quite frightening that people are going to Google looking for X, getting Y, people are mixing up fake Ozempic and stuff, and we as practitioners, you can't stop it, we can't. But it made me feel more confident that I could speak to somebody about this particular case. I think I know what I'm doing. Can I just run it by you? And I think that's just as important. I could tell you everything in the clinic. I could tell you, but what works now to get, let's say, you know, you've got an inflammation going on, you've got, you know, what's going on with the pigmentation, that skincare that you're on now might be wholly inappropriate for what we're doing a bit further down, because skin changes, we change.
Yes.
Yeah, that's very true, and a really good point as well is that, you know, sometimes when people talk about, oh, you know, you need to be on this line, again, we don't really work like that with Glow. The way that we work and the way that we train is that we like to have a good understanding of the skin and the science of skin, so that then when a patient comes to us, whatever they're presenting with, as practitioners, we kind of think, right, which cell is that's misbehaving? And then we know ingredients that can then work on that cell to, you know, regulate, upregulate, whatever it is it needs. And that's the way that we work. So it's also not the kind of brand whereby, you know, you kind of have a box for oily skin and that person takes that box and that's what they use. It's very, very prescriptive. That's what I think most of our clinics love about Glow, is that you can just bespoke it to that skin. And let's say you come in for regular treatments, again, as Emma says, 1 month you might have a certain type of treatment, or you'll come in and you'll be like, my skin's been amazing this month. I've had no issues with it, loved it. The next month you can come in, your line of work, very stressful. Like you can be like, I've had a horrible few weeks at work, my skin's awful, my diet's gone to pot. And it shows in the skin, which means that we're not going to do the same treatment that we did last month because it's now not appropriate. So, that's the other thing, is being able to have lots of tools available to you as a practitioner to make sure that you've got something that will work well for that condition, that concern. So, yeah, that's another thing to consider when you're choosing your practitioner and when they're taking through the treatment plan too.
Thank you so much.
We've got a minute and a bit before this cuts out. So, Sadia, have you seen on the chat, there's some links on there? So you've got the WhatsApp and WhatsApp, so that you can...
Yes, I've seen the WhatsApp. Yep. So I just
ping
click the link, join onto it.
Yeah, ping us a message. I mean, I've got a question as well. And then me and Ros can get in touch with you, take it from there, and we can work together.
Well, perfect. Thank you.
In the last minute, has anybody else got any questions?
I love you, Emma.
I'm
not on screen because I've got my pajamas on.
Oh, good for you. Good for you.
I'm going to be seeing you again. You're regularly with me, bless you. Oh,
Live with you.
oh, thank you very much, everyone. But, have a think. Any other subjects you want us to do? Just ping us a message. The WhatsApp's on there. And thank you, Lydia, for coming.
You're welcome. Anytime. Lovely to meet
Thank you, Lydia.
You're welcome.
We're all superstars. All right.
Have a lovely rest of your evening, guys. Thank you.
Yeah, everyone. Thank you for coming. Bye.
Thank you all. Goodbye.